طيب بسم الله الرحمن الرحيم. السلام عليكم. Now we're going to talk about professionalism and basically what are the professional duties for you as a doctor. In our presentation or in our talk today, we're going to talk about the doctor's relationships and roles, which are basic and important things that you should consider as a part of your practice, actually. The second is we're going to talk about the professionalism. What do we mean by professionalism, and what are the professional attributes that you as a doctor should guard and should keep all the time. And when we're talking about the doctor's duties, we're basically talking about your duties towards yourself, your duties towards your colleagues, and your duties towards your profession, and indeed your duties towards your community. So before we start, let's see you as a doctor. Where are you? In a hospital. Who's in the hospital? There are health educators, there are the managers, there are the nurses, there are the social workers, there are the other technicians, and here we come the doctor. So basically, and all of us we are there in the hospital just for the patient. So basically, doctors are not the focus of healthcare. Unfortunately, due to the way we've been taught medicine, at least at my version of medical education, there was some sort of, you're the best, or the creme of the creme, you're the, so somehow doctors get this inherent arrogance, I would say, like feeling that they are the focus of the whole thing. We should always remember that we are all for the patient. So, you as a doctor, what are your roles? You have the role as a healer, this is for true. You have a role as an educator or a scholar, like those who work, or those working as educators in the faculties of medicine. You have an important role as a researcher. You have an important role as a planner, as a health advocate, and indeed as a communicator. So basically, these are the roles or the competencies that you should, as a doctor, always have in mind. It's not just a matter of a healer. You're not just someone who's dealing with the sick bodies. You're dealing with a whole package, because by the end of the day, you need to work with your, ethically speaking, your knowledge and your skills for the development of the whole community, including the healthy people and not only the sick people. If we're going to define the professionalism, there are many definitions actually. But the American Board of Internal Medicine defines it as constituting those attitudes and behavior that serve to maintain patient interest above physician self-interest. So basically, you should always have in mind that the patient comes first before your own personal interest. That's what makes you a professional doctor. Professional competence is the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, whatever you have, and reflection in daily practice for the benefit of the individual and the whole community being served. So basically, again and again, it's about your patient, not only the patient, it's about your community, healthy and sick. So if we're talking about the ethics of professionalism, we are talking about what are the characters that you should, and behaviors that you should, as a physician, have or have not. So there are some desirable behaviors. Basically, we're talking about the altruism, accountability, excellence, duty, honor, integrity, and commitment to lifelong learning. On the other hand, the undesirable conduct or behavior that you should refrain from, basically the abuse of power, the bias, the sexual harassment, the breach of confidentiality, the arrogance, the greed, misrepresentation, impairment, lack of consciousness, and conflict of interest. We are not going to go in deep details of each of those. However, I think it's quite important to have a very fast look on the undesirable first, to avoid them before going for the good attributes. Abuse of power, doctors sometimes, when you are a manager, you are the top of the hierarchy. Sometimes some doctors, especially the senior ones, I would say, somehow abuse the power they have, either by trying to impose a different set of values or what they think, or to even coercion of their students or residents. There's also some kind of bias to people from your, from your race, from your region, from your geographical, or from your town or village, or bias towards the given sex, or against actually a given sex. The sexual harassment, it's not just the act, it's even sometimes it's verbal harassment. And you as a doctor should be very careful in dealing with patients of different sex. Arrogance, as we mentioned, it's nothing to be arrogant about. Your knowledge, your skills, everything. First of all, again, I'm talking to you as a Muslim patient, as a Muslim doctor, that you should always know that it belongs to God. It's Allah who gave you all of these. So what's the arrogance all about? If you're talking about the greed, unfortunately, some doctors, when they start earning money, they get this kind of greed, and they want to earn more and more money on the expense, on the professionalism and on the expense of their patients. Sometimes misrepresentation, if you're going to represent yourself, for instance, that you are a specialist in that or consultant in that and you're not, or sometimes you, instead of referring your patients to a specialist, you manage the cases by yourself, and this is not a professional attitude. And again, conflict of interest, we are going to talk about that later. I'll give you, I found very nice quotes actually, which give us a clue that the Muslim scholars and Muslim doctors have been thinking about this. And please read with me this quote. The physician should be modest, virtuous, and merciful. He should wear clean clothes, be dignified, and have well-groomed hair and beard. He should select his company to be persons of good reputation. He should be careful of what he says and should not hesitate to ask forgiveness if he made an error. He should be punctual, reliable. He should wrangle about his fee. He should not wrangle about his fees. He should not give drugs to pregnant women for abortion unless necessary for the mother's health. He should not honor himself by shaming others. This quote was said by Al-Tabari like almost more than 1,000 years ago. So basically, the pioneers of Islamic medicine actually established very good basis for professional attitude and for professionalism from Islamic perspective. The oath of a Muslim doctor, you swear, or the doctor swear by God the Great, to regard God in carrying out my profession, to protect human life in all stages, in all circumstances, to keep people's dignity, cover their privacies, and lock up their secrets, to be all the way an instrument of God's mercy, extending my medical care to near and far, virtuous and sinner, friend and enemy, to strive in the pursuit of knowledge and harnessing it for the benefit, not the harm of the humankind indeed, to revere my teacher, teach my junior, and be brother to all members, or sister indeed, for all members of the medical profession, to live my faith in private and in public, avoiding whatever blemishes in the eyes of God, his apostle, and the fellow faithful. And then we put it. I know it seems to be, at least this is actually my impression, I would say, when I had to do this oath. It seemed to be too idealistic, or too, perhaps, it seems to be hard to achieve all the time. But there is the rule that we have in Islam, or it's somehow of religious basis. It's if you can't get it all, don't leave it all. ما لا يدرك كله لا يترك جله. So basically, we try to do our best to achieve this, and try our best to adhere to these values. You as a doctor have duties towards your patient. You should show respect for your patient. You should respect their privacy. You should provide them comprehensive care. You should respect their autonomy, as we mentioned in the first session. That is to say, to respect your patient's ability to take their own decisions by themselves. Indeed, you need to tell the patients, and we will talk about that later in more details in the consent session, protect the patient's interests and keep their secrets, that's to say, confidentiality. So basically, if we're talking about the duties as they are in the Saudi Commission guidelines, you as a doctor, you should listen carefully, treat fairly, and show respect. Treat them, your patients fairly. You should not, do your best to avoid any kind of discrimination because he's not of your religion or not of your sect or not of your race. It's very important to provide advice and be supportive. And ad-din al-nasiha, advice is a very important thing for you as a Muslim, and you have to always be supportive for your patients as well as your colleagues as well. Respect privacy when examining the bodies of your patients, whether males or females. People usually do not, as we'll talk inshallah later about privacy, but it's important to mention that people do not usually like being exposed, especially in front of strangers. So basically, we should respect that. Although we as doctors, when you keep on seeing exposed bodies all the time, you feel some doctors, not all of you indeed, at least some of you would lose this sense of respect for the body because we see bodies all the time. So sometimes we just forget and we don't care about the bodies of our patients, and this is crucial actually. Keeping the patient's medical information strictly confidential unless, and we will talk about the confidentiality in another session, it's very important that the rule is that you should not share any medical information regarding your patient unless in certain conditions, and we will talk about that later inshallah. Provide the best of your knowledge and skills needed for the condition, even if they are incurable or terminally ill or dying. This is very important actually because sometimes, especially those of us who deal with terminally ill patients, incurable diseases, late-stage cancer, dying patients, comatose patients, etc. Sometimes, especially when the patient is admitted for a long time, sometimes this could happen that we do not provide them enough care, as if it's just like something inside that says, they are dying anyway, so why should I waste my resources and my time? It's better to give it to someone else who can make use of it. And this is wrong, actually, because you as a doctor, you are committed to provide health care to the very last moment of your patient's life, and even after death of your patients. Refer to a specialized or more expert physician as needed. Some doctors, I won't say again, I would refer to arrogance actually. You feel like, okay, I can do it, I can handle it, I will go, but you know that you have another colleague, a more senior one, more expert one, to whom you can refer the patient, then directly do not hesitate to refer the patients if you're not the right person to do this. Refrain from causing any harm to your patients, whether intended or unintended, and we will talk inshallah later about the medical error and the medical mistakes in general. Take consent from patients before any intervention, and again inshallah, we are going to talk in detail about the consent, but again, this is the way you show that you respect your patient's autonomy. Towards your colleagues, actually there are quite a list that you should, of duties that you as a doctor should do for your colleagues. You have to deal with them and act toward the colleagues in a good manner. And in the same way, you want your colleagues to treat you. So it's just to be respectful, to be decent with your colleagues. To avoid direct criticism to your colleague in front of patients or other colleagues, actually. And this is unfortunately, sometimes it happens. That, okay, a patient goes to a doctor, and that patient was with another doctor before coming to you, and then, oh, what's going on? How could he prescribe you all these drugs, and he made you a wrong diagnosis, and you start saying bad things about your colleague. You should not do this. Not to indulge in defaming the honor of his colleagues. So basically, your colleagues should not, you should not, somehow try to defame your colleagues. To exert every possible effort to educate your colleagues. So basically, you have the duty to educate yourself indeed, to educate your colleagues, especially the junior ones and those who have less expert. And by the way, when we're talking about the duty to educate, you don't have to give them a very huge topic. Sometimes a very simple thing could help them a lot. For instance, how to take the pulse, how to hear the proper heart sounds, how to read an X-ray, how to read an ECG. These simple things could make a lot of difference later on. You should respect the difference of your colleagues. So basically, especially when you are dealing with people who have different background, different race, from different region, you should be aware of these cultural differences and respect them as well. And this is quite important actually if you're going to study or work outside of Saudi Arabia. You will be dealing with people from different background, and frankly speaking, okay, for instance, I had some colleagues and some even teachers in Canada who were Jewish, for instance, and it was my first time to have this close relationship with Jewish, and it was actually a good chance to have some discussions. The physician should respect other non-physician medical professions. Unfortunately, doctors somehow tend to undermine the roles of other non-doctor colleagues. They come just like he is or she is a paramedical, as if you are the focus. And as we mentioned from the very beginning, you're not the focus, the patient is the focus. You should all collaborate. We are a healthcare team. You're not the doctor. It's not a one-man show. You are the doctor alone. You'll not be able to do anything without the technician in the lab, without the technician in the radiology, without the nurse on the bedside. So basically, don't forget, you are just a part of the team, and you should show respect to this team and to show proper leadership for this team. He or she, you, should report the incidents in which a colleague could be dangerous to the authorities concerned. And this is actually a touchy issue. Okay, she's my colleague. How can I, tell the manager or the medical director that she's done that thing, or she is, or for instance, she got a contagious disease, a hepatitis, for instance, hepatitis C, and she did not report that, or she got, for instance, HIV/AIDS or whatever. At this point of time, it's again the very basic thing is the primary interest is the interest of the patient, not your personal interest, not your colleague's interest. We are all there in the hospital for the patient. So anything that would endanger the patient, whether, and by the way, it's not about just infectious disease. Sometimes some of our colleagues have bad manners in dealing with patients. You try to advise them, but they do not listen to your advice. At this particular point of time, you should somehow report to the authorities, whether within the hospital or even the MOH, the Minister of Health. Towards your profession, you should respect the honor of the profession. Listen to me. This is a very basic thing. You see it every day. Wherever you go, you are the doctor. Even in a wedding.